This is a case of suspected bilateral anterior ilium, bilateral anterior tilt of the pelvis, with a unique feature in that when I load her right ilium, I can take up the slack. But you'll notice that the other side lifts up immediately. And this correlates with dysfunctional movement through the SI joint impaired by the sacrum. And that happens on either side. When I take up the slack on the right side, on the left side, when I take up the slack in posterior rotation on the left side, the right ilium raises, but it does so in the transverse plane. So it's important to look at the structure when you're taking up the slack and spring testing. So it's not really just about movement, which I emphasize so very much, but it is also observation, okay? It's interesting also that I can actually get some spring mobility, but there's no recoil. And that's a peculiar finding. Usually there would simply be blocked mobility. But again, I can take up the slack, and then I can get a little bit of spring mobility, but there's an absence of recoil, which is an unusual behavior. And we simply treat what we see and find. And I'm going to have her lie on her stomach, and I'll show you what the behavior of the sacrum is. Now, before I show you the sacrum, I'm going to show superior glide. And I can take up the slack, and I can spring, and I can see her shoulders bob up and down. So there is good force transmission through the rest of her body. And that's true on both sides. So I can spring it, and there's a recoil. Now, when I try and do inferior glide, I can't even take up the slack. It's already taken up. I'm not able to get inferior glide of the pelvis with a reasonable amount of force, which is 15 pounds of force. And the sacrotuberous ligament is rock hard. Feels like bone, does not feel like ligament. It doesn't have that little bit of yield. The sacrum is very prominent. Now it's prominent in the lower portion. So she does have a sulcus coming off the PSIS medially. Now, the PSIS is the horizontal axis of rotation, so if I put the heel of my hand just above that, you can see that I can take up the slack. It takes up quickly, but I can induce a little bit of rotational force. And I come up to L5, and now I back it down to about 10 pounds of force, and I can get movement at L5. And then the same thing at L4. When I come down to the lowest part of her sacrum, there's no give at all. It feels like I'm pushing on a big block of wood. And now when I push inferior glide to the sacrum, there's no give. So she's very rigid. This is not absorbing shock. And one of her symptoms is that when she goes shopping and she's walking on a hard floor, within about 10 minutes she starts to get more back pain. She also gets foot pain. I'm not going to elaborate on that for the purpose of this video. The treatment that I'm going to do is to have her lie on her back and hug her knee outside the axilla. So we're treating an anterior ilium one side at a time. And I'm going to do that twice for 2 minutes on each side, okay? That's where we're going to begin to improve mobility. If that doesn't satisfactorily improve movement, rotation in the ilium, then I'll treat her for a upslit bilaterally of the ilia, which I haven't seen. But the behavior is a little bit peculiar, again with the posterior rotation spring tests, so it kind of cues me that there might be something unusual going on here. So in the workbook you can see the other methods of treatment that I would use after restoring posterior rotation of the ilia, then I would put 2 pillows under her stomach to flex the lumbar spine, and then I would work on restoring inferior glide of the sacrum, just hooking it with the palm of my hand and gliding it inferiorly for 2 minutes. After that, I would have her lie on her back, and I'll put a piece of foam across the lower sacrum, and I'll have her hips and knees flexed 90 degrees, and the purpose of that is to backward bend the sacrum. And the exercise approach for this pattern would be a flexion exercise program, and the workbook has several additional exercises, including traction, to address this kind of a pattern. So I'm going to stop filming now, and we'll start treatment, and we'll film the response to treatment.